Livingston County Administrator, and I'm here to give you an update on COVID-19, the response to date, but primarily focus on news of reopening in the Finger Lakes region and what it means for Livingston County, also what it doesn't mean, and a couple of other things about county government operations, testing, nursing homes, and then kind of close with some more reopening comments. Only have about those 4 or 5 things to go over with you today, so we should be brief. I won't take up too much of your time, but hopefully these information updates are valuable to you as we try to relay as much information as we know it to the public in various means and mediums, this being just one of them. Before I begin, I do want to let you know about the census. Well, I've got all your attention, you haven't dropped off yet. The census, so it's 2020 census. We have a response rate by county in the region. There's 11 counties in this mix. We're doing quite well. I would like us to do a little bit better, and I would like you to do your part on trying to bump that rate up a little bit. So we are currently behind 2 counties that shall remain nameless, as I've said before, but we're not too far behind them. So we're sitting in 3rd place in that self-response, but we are gaining traction on those adjacent counties. And our municipalities, I will say kudos to Caledonia, Leicester, North Dansville. You're our top 3. I've got Portage, Groveland, and Nunde bringing up the rear, so to speak, in those 17 towns in the county. Decent response rates, but let's see if we can get those up. And the rest of the towns are a little bit of a mixed bag. So again, encourage you all, wherever you are, to do the census, complete it. It's very important. A lot of funding formulas and federal government allocations as far as program funding are predicated on population-based formulas, so please, anything you can do to complete that, however you can, please do so. So the update, I want to give you an update on reopening. Reopening is a big deal. It's talked about all the time, rightly so, because we are in sort of a closed environment. We're in a paused environment from an economic, certainly some social aspects as well, business, continuity of government, all of those things are kind of a little bit paused as far as what we're used to seeing in all of those different sectors. We are experiencing that on the personal and professional side as county government employees. I know you are as well. And we hope to today give you a little bit of an update as far as where things are at on reopening. You probably heard the news. The Finger Lakes region is one of those regions that is right now meeting the 7 of 7 benchmarks necessary, the metrics that are being watched in this state-driven, state-governed formula. The Finger Lakes region does meet 7 out of the 7 benchmarks. So we are poised, and we will be reopening in Phase 1, Livingston County, as part of that region this Friday, which is the 15th of May. What does reopening mean? Well, it's predicated on those 7 of 7 standards. I'm not going to go through them right now, but we need to, of course, keep those up throughout all of the phases. That's very important to note. Right now, we do meet them, so that determines whether or not a region can reopen. It's not our call. There's been lots of questions. Why does the county open up this sector? Why isn't this sector included in Phase 3? It should be in Phase 2. Lots of those questions. The Home Rule Authority is not there for the county of Livingston, nor any other county for that matter, to make certain calls of that nature as it relates to the reopening. So we are participating with the region in this phased reopening. There will be a regional control center. Well, what does that mean? That means a group of elected and appointed officials in the multi-county region. I'm on it, as is the Chairman David Lefebvre, who will gather information, get all the metrics, hear updates, frankly hear complaints, try to challenge, try to critique, try to present to the governor's office in Albany what would be recommendations for the various phases. I do want to go through that Phase 1 update as far as what's in Phase 1. Now remember, Phase 1 is a first of what's told to us to be 4 phases, each having a roughly a 2-week window in between each phase, where those 7 benchmarks will be looked at again, and then Phase 2 will be considered to start. So for us, at the earliest, we'd be able to start elements of Phase 2 on the 29th of May. So the phase reopening beginning the 15th, includes sectors of the economy that are not already open, but including this select list: agriculture, forestry, fishing, construction, manufacturing and wholesale, supply chain, retail with curbside pickup, landscaping and gardening, outdoor low-risk recreational activities like tennis. That was the example provided by the state and the governor's office. We expect some clarity and guidance on that today, some more specificity, and then drive-in movie theaters. This is in addition to all of those essential businesses that were allowed pre-pause or during the pause, if you will, to maintain operations. So there's obviously been a lot of business continuity. As much as there's been, yes, there's been tons of business negative activity associated with running a business, so closures, guidelines, can they open, can't they open, I understand that, and we hear a lot from businesses about that issue. We're not in control of that, but we're working with you to try to get you reopened within the confines of public health best practices, and for what we're dealing with within the construct and the restrictions of a phased reopening. So there's lots of other things that are called for in the other phases, just to give you a rough idea of what those are. Phase 2, professional services, would include government that hasn't yet opened, finances and insurance, retail, administrative support, real estate, and rental leasing. Phase 3 includes restaurants, food services, and hotel accommodations that aren't already open. And phase 4 says arts, entertainment, recreation, and education. All through that, obviously, there's lots of particular and specific business enterprises that aren't individually listed there. I encourage you to go on our website to check out the resource section. That links to the resource section that will govern all of this, which is the Empire State Development Governor's Office resource listing about pause and unpause. I realize that the social issues aren't addressed in any of the things I've just said. So can we gather again at some point in time soon? What about the masks? What about social distancing? All of those things. We expect to have guidance on those probably this week, because there was, again, there's really two phases of all the phases, right? The pause order ratcheted down the economy, ratcheted down really life as we know it in a series of incremental moves, and those gradually will be incrementally ratcheted back up. But it wasn't just these businesses were essential and non-essential, and they have to scale down to the point of closing or temporarily suspending operations outright. It was also gatherings of no more than 50, no more than 25, whatever. All those levels were also included, to the point where gatherings of any size were, in the words of the state government, disallowed. So we are waiting to hear what the guidance is on the social aspects of the unpause for regions that are included in the reopening that is going to begin on May 15th. I want to say a kudos to businesses. How we move forward as a county will be greatly predicated on your involvement in this whole effort. Obviously, they've been impacted, the businesses, so it's, the patience throughout this whole process has been amazing. We struggle with it as well. We have elements that we've said should be in phase 1 that didn't make the cut. One such example would be Main Street retail. I'm of the personal belief that Main Street retail would be able to keep social distancing just as much as a big box retail would be in another part of the county or part of the region. That didn't make the cut. Only curbside retail did, so not really in-store traffic like you would have at Wegmans or Walmart. You right now cannot do and won't be able to do on the 15th for Main Street retail. But we're pushing for changes associated with things like that. The guidance will be updated. And also, it's really hard to do. I totally understand. I still have a job. Many of you don't. I understand that. I empathize with what you're going through, and I realize that there's been a lot of heartache, struggle, and economic turmoil in this county. That being said, we are in a region that is allowed to reopen and has the benchmarks met to reopen beginning the 15th. So there's an element that trying to see the bright side here myself, and I struggle with this, trust me, but trying to be an optimist, trying to see the bright side. There are other regions in the state that aren't going to be allowed to commence a phased reopening until the earliest June 1st. So we are in that mix. I'm grateful for that. I think we're fortunate that we're there, but let's not, kind of like let's not screw it up here. Let's continue to work together, continue to be responsible citizens, continue to follow the guidelines that are out there. This will be a phased-in approach. It will be methodical, and it will be grounded on public health facts, public health guidance throughout. So just as we ratchet it down, we will ratchet back up. The last thing on reopening before I segue into testing and tracing, you basically have two camps. So we're the county government. We are hearing from the two camps. And of course, we are in a position where we are trying to interpret guidance as it comes down from the state, comply with any directives that are out there ourselves as an institution, as a government entity, but also provide as much information as possible to the public, who is often confused public, a perplexed public. What's going on with this regulation? Am I essential? Am I not essential? What does reopening really mean? And do realize that reopening phase one, as I said before, I'll say it again, is not carte blanche whatsoever. It's phased in, it's methodical, it's pieces. Those things that I read off in terms of the sectors that are allowed to reopen are those sectors that are allowed to reopen. But back to the two camps. We hear from a lot of people, and the people are, there's the middle ground, right? And then there's also the camp of we should reopen everything tomorrow. And there's also the camp of we shouldn't reopen anything on Friday. And we hear from both of those. So if you're on one of those sides, in one of those camps, all I'm asking you to understand and appreciate is that many of your fellow residents and citizens and neighbors might be on the entire opposite of that spectrum as far as when to reopen, how to reopen. Many people are still fearful of that. Many people want us to do even more and push even harder and kind of try to exercise some level of autonomy that frankly doesn't exist. We hear both sides, we understand both sides. We're trying to kind of walk that tightrope to be the best, prudent decision-making government entity that you deserve and require in your own struggles. So we're trying to do that. We're trying to be a responsible partner with the region. We're trying to do this in a phased-in, again, methodical approach, and I hope you understand that. I know you might not like it, but I just hope that you at least understand where we're coming from and the messaging that we deliver and the why behind that messaging. So let me switch gears to testing and tracing. If you're just joining us, my name is Coyle. I'm the county administrator in Livingston County, talking to you a little bit about reopening and COVID-19 related matters here. I shouldn't be much more than about 15 minutes for those of you that are just joining us. I will talk about reopening at the end again. So testing and tracing are big items to talk about here. The 7 of 7 standards met. The last two that we had to meet were testing and tracing. We're right now at about 1,500 tests per day in the region. We, of course, are now testing asymptomatic, essential healthcare, first responder workers. MCC is the closest for that, but we also have the curbside testing at NYS Hospital at both of their Geneseo and Dansville locations. So that's 7 days a week. Tracing is also an element of testing. So once you test, you identify a potential positive in that mix of folks that got tested, asymptomatic or not. You identify a positive, you have to isolate, mitigate the spread, and then trace the contacts of that individual. And that takes a lot of work. And as we test more people, we'll have more people ping positive. And as we have more people ping positive, we will have more resources needed to go trace the contacts of those people newly identified as a COVID-19 positive. That's the only way you're going to really control the spread. And this is a very, very easy, a virus that's very easy to spread. The infection rate's very high. So we need about 19-20 tracers in this county. We're prepared and able to do that. So now we meet the benchmark individually as the county of Livingston. The region it rolls up to a much larger number. All of those counties are meeting their numbers. So now the whole region, from the contact tracer perspective, meets the numbers. You will see some advertisements for contact tracers that affords an individual an opportunity to apply for this job. I encourage people still to do that because we need to keep filling the ranks and these armies of tracers that are going to be necessary to, again, trace the virus's spread throughout the region. We have a new mandate as it relates to testing. I'll get into the nursing home issues as a whole, but the nursing homes are under a new mandate effective Sunday at noon. We have to do a plan that's due tomorrow, and the testing requirement is quite staggering, to be frank. We run a nursing home in Livingston County, as many of you know. We have a 266-bed, excellent, wonderfully staffed public nursing home in Mount Morris, New York, and that is a $33 million operation. It's got about 400 people or so that work there on every day between dining and nursing and administrative functions. 400 people now have to get tested twice per week under a new directive. So that means 800 people just in the county of Livingston's nursing home per week need to get tested under this new nursing home mandate. To put it in perspective, we've only tested in this entire county 1,700 roughly people to date for COVID-19 since testing started. So moving forward, we need to test in a 2-week span almost the entire amount of people that we've tested, period, since this thing started. You probably have seen the news. Test kits and the swabs are very hard to come by. Also now lab capacity becomes an issue. We're just one nursing home. We've got 2 private nursing homes in the county, Avon and Canisius Lake. We've got many, many more nursing homes in the Finger Lakes region. Certainly in Monroe County has quite a few. All of those nursing homes are under the same exact mandate, whether public, private, or nonprofit. So how we as a region, how any region frankly, is able to comply with this, from where the capacity comes from and where the labs and who are the labs that are able to do this testing, is a very interesting question, and it's a challenge I think for the state to come up with those answers. So that's testing and tracing. Let me get to nursing homes. So nursing homes are under the microscope, and rightly so. Nursing homes are the most fragile, medically fragile, vulnerable populations. They're in tight confines and close quarters oftentimes. They're in an area that's isolated, that's in one building, there's no coming and going. Obviously that helps control the spread in some aspects, but also if everybody's there and there's no place to go, it also has an element of adding to the spread capacity that should a virus present at a facility. So there's been lots of talk about nursing homes. I won't get into the politics of it other than to say you, if you're a resident of Livingston County, should be proud that the County of Livingston has been on the forefront from day one. In fact, way ahead of New York State and way ahead of a lot of other folks in terms of doing what we thought was responsible and right as it relates to nursing home operations. Because we run a nursing home, we kind of know a little bit about it. We've run it for hundreds of years, so we know what we're doing here. But certainly the notification system was set up before the state set up their notification system. We closed a nursing home before the closure order went into effect statewide. We started testing staff before the testing mandate came across statewide, and we were challenged by the decision to have entry into a nursing home from a hospital of a COVID-19 patient. When the directive initially came out, we were very challenged by that directive. We didn't think it made sense. Now that state directive has been put back or redacted or retracted, so that no longer exists. So that certainly was a challenge for many nursing homes. We have 3 nursing homes in the county. We do have challenges as it relates to the Avon nursing home. The other 2 nursing homes presently do not have residents that have tested positive, Livingston County and Canisius Lake, but Avon does, and they have quite a few people that have tested positive. As a percentage of their total resident population, it's quite high. The number count as an absolute number is not a huge number, but it's a number as a percentage of total bed count that's very high. This is not an assertion that the staff is doing anything wrong over there, that the management is doing anything wrong over there. As I said before, to numerous press inquiries, they could have the best infection control practices in the world, but something is going on at that facility. Something has gone on at that facility that has caused the spread to be what it is in Avon. It challenges me that more cannot be done at the state level to assist that facility and to try to curb that spread. So again, that is what's going on at the nursing homes. There are new testing requirements. As I mentioned before, you know what they are now, but all of those 2 and the public nursing home will both be under the same requirements to test their staff twice a week. They are going to be likewise challenged in the 2 private nursing homes by this new state mandate. I'm sure they're equally perplexed as to how they're going to meet the mandates of this new requirement and this directive. But just talking specifically about those 3 nursing homes together in the county. We've also got some senior living arrangements, Alpine Manor, Morgan Estates, but I'm just specifically speaking to the 3 nursing homes that are classified as skilled nursing facilities. I want to just thank the staff at all of those facilities for the work that they're doing each and every day. They walk into the environment knowing that the people that they work with could be affected by this virus, that they themselves could be impacted and affected by this virus, that the death count in this state is quite high in terms of nursing home deaths, and that the virus penetration rate in these nursing homes statewide and nationwide is quite high. And then you have this vulnerable and fragile population that all of that going on cannot physically see in person, have the visitation that they're used to, having their loved ones alongside of them to kind of help them navigate through these tough times. So I want to special shout out, especially to the staff that we employ here in Livingston County, our Livingston County CNR staff. Kudos to you. Thank you for all that you're doing, and also for those other nursing home staffs across the region, including the 2 in our county. Thank you for all you're doing to control the virus's spread in nursing homes as best you can. Last 2 items I want to talk about. The first is county government. So many operations are essential. So mental health and public health, the nursing home, sheriff's office, certain highway elements, certain buildings and grounds elements, social services. Lots of things have not really stopped at all from the start of this virus, mainly because, as I said before in many of our press releases, essential services are, public services, really the definition of essential service for many, many people in many, many aspects. So when we talk about this federal funding push that has gotten a lot of controversy of late for this new stimulus package, part of the messaging has been about essential funding for essential services. Livingston County has not been in receipt of any grand, stimulus funding that has come other counties' way because their population is a little bit higher than us. So I think the chance to right that and equalize it and make it equitable across the board to all counties is in the hands of the federal government. I hope they do that. I hope they realize that funding that went to other places, again, airlines, even small business, other big business, places like that, should indeed flow to those organizations and entities, i.e. county government, local government, that fund and operate the essential services that are at the forefront of the crisis response. But again, county operations continue. Sometimes you got to make an appointment, sometimes it's telehealth, sometimes it's call or email, but know that information will be coming out this week and next, which will dictate what elements of the county government operation start to flex a little bit in terms of reopening in preparation of an early June reopening of government as far as the orders that are coming out. Do realize, related to the financial impacts that I've talked about a little bit, our sales tax returns are down. They're down 30–40% in this May time period. We've got 2 checks. They usually come in at about 2.5 million. They came in at about $1.7 million, $800,000 down from what it used to be, and historically it is in the month of May. State aid, the cuts will likely come this week. What are the cuts going to be? We don't know. What areas are they going to propose cutting? We don't know, but we do expect them to hit this week. So we've made some mid-year cuts. Those have been in the $1 million to $2 million range for the county general fund. We've held vacancies, we've curtailed programs, we've slashed some spending within the current year, and that all totals up to that $1 to $2 million range. We're looking at other retirement incentives, we're looking at furloughs, we're looking at other elements of staff reduction that are possible. So the county itself, as a government organization that employs 1,200 people and that has 32 departments and is a $170 million corporation, is not immune to the cuts and the heartache and the tough decisions that you see out there in the community from small business, nonprofit, and the hospital systems. So I will finish with some kind of closing thoughts on reopening. So we need to be diligent. We need to continue to be the responsible citizens that you've been throughout. Again, I applauded staff earlier. I want to applaud the residents of Livingston County. So there's been a lot of pats on the back lately from politicians about you guys did it, and I don't always agree with those sorts of commentary, but in this case I do. So the hard work was not by government, but by the people in responding to what has been the edicts, if you will, or the regulations, executive orders from state government or from the federal government on downward to us asking our county residents, please do this, please do that. You have to wear a mask when you go into stores, or you can't be within amount of distance between folks. The hand washing, what plans businesses will have to come up with when they reopen. All of these new normal changes would be impossible if not for the patient support, buy-in, collective willpower of the community of Livingston County. So we appreciate that. But again, we have to be patient. This is going to be grounded in science. As I said to our own people, when I talk about economic development, which is really now economic redevelopment in some aspects, how do we capitalize on what the new normal is going to be? Livingston County is not a dense area. We're probably not going to get hit with the same kind of numbers everybody else is. We just have a different population, a different demographic, and different density. But it's going to be a bad situation for every county, right? Everybody's going to have sales tax impacts. Everybody's going to have state aid impacts. How do you separate yourself from every other county government in terms of capitalizing and bouncing back better off from where you were before, when you're faced with the same onslaught, same turmoil that everybody else is? So that's the charge that I've given to the department heads. That's the charge I've given to the folks at Economic Development. That's the charge that I give the Chamber of Commerce when we talk and connect on this issue, is that how do we build ourselves up after this, and how do we start thinking about that? And the thing I want to leave you with is, it's not a flip of the switch, everything reopens here on Friday. I see more cars out and about. I see some more traffic out and about. That's great. Patronize the businesses that you can, order takeout, get the curbside retail come Friday. Patronize those businesses, support those small businesses. They supported you when times were tough. Times were tough for them. I say it every single time I'm on these YouTube Live. But again, we I think are more agile. I frankly think we have a better financial picture as a county government than a lot of other counties. So I think we can bounce back from this and again, be better off and be well positioned, but we can't do it without the support of the citizenry, the residents, the small business, kind of all working together towards that common goal. So being patient, working together, helping your neighbor, getting through it, again, and being understanding of what we're all working under. This new normal is going to affect all of us. It affects you, it affects me. So please be patient. We need to continue that positive mindset. So we have an opportunity to come out of this, kind of rise from the ashes a little bit, stronger together for having been through this really, really incredible, a once-in-a-lifetime type challenge. No matter what you think of anything about the closure or about the pause or whatever, I just tell people, you got to deal with it. We're dealing with it. You have to deal with it. It is what it is. We will work through it, deal with it together, be strong. Again, stay strong, stay positive, stay healthy. That's my central message I deliver 10 times a day to people here. They probably get sick of me saying that. But you need a positive mindset to get through this. So I hope you maintain that as well in the community. I appreciate your attendance here today in this virtual YouTube Live session. I do expect more press this week, guidance on the social aspects of the closure, the unpause kind of clarity of what it really means for this county, regulations on the state website as far as who's what for essential and non-essential and what this really means, and then what to expect in those phases down the road. So again, thank you very much for participating in this YouTube Live performance. My name is Ian Coyle. If you have any questions, you can find me on the website. Look me up. Go on social media. Look us up. Ask us any questions. We'll be happy to help you out with whatever issue you have. Thank you.